Okay, so now I'm going to introduce the actual implant hardware. This is the system that is actually used to place our implants, and it's very system specific. And I'd start off by just showing you the top layer of the tray here. Now, you'll see it's a very minimal kit. We don't believe in lots of instruments, lots of burrs, lots of drills, lots of drivers. All this causes a lot of confusion, not only for the dentist, but also for his support staff, the nurses that have to clean and maintain this equipment. It's very difficult if there are multiple components and multiple instruments. So we've deliberately kept the whole kit very minimal. At the end of the day, you just want to be able to place the implant as simply and as conveniently as possible. You'll notice there's 4 empty areas here. This is for your own personal use. Some dentists like certain burrs or certain pilot burrs. That can be added at your preference. The main system burrs work here, and we have 6 burrs altogether. That actually are the sizing burrs for our implants, and 1 pilot burr. The pilot burr is a 2mm burr. It goes from 0 to 20. The next burrs are either long or short, and the short one goes again from 12 to 0, and the longer burr goes from 0 to 20. And you can see that it's labelled long and short for your nurses, and the burrs themselves are colour coded yellow to yellow. This makes it very easy for anybody that's packing and sterilising it to know that all the burrs are present. These colours actually represent diameters of implants. So what if you were to place a 3.75 implant, you go pilot, you'd go this size, and then you'd finish on the final one. You know that this is the blue one, and the blue one actually marries up with the blue coding on our implant packaging. So rather than trying to remember sizes or diameters of implants, you just know that this burr is required to place this diameter implant. It's very simple, blue implant to blue burr. And then we have our final size of implant here. This is for our largest implant, which is 4.5 diameter. So this burr will be for the 4.5 diameter implant. And you can see there's little silver lines and gradations that again match with our implant sizes. We have a 5mm line. We have a 7 to 8mm line, which would be for our short implant. We have a 10 to 12mm line, which is for our 10 or 12mm implant. And finally, at this line here, we have a 15, which marries up with our 15mm implants. Again, some burr systems have lots of markings, but that really isn't necessary. You just want to know that you've drilled down sufficiently to place the implant of your choice. Just in case you forget that, there is a remembrance diagram here to aid your memory. So you know the first line or the first white line is at 5, second white line is 7 to 8, next white line is 10 to 12, final white line is 15 to 17, the burr ends at 20. So this is a very easy, in case you forget which lines marry up, you can easily look at the box and remember. This is not to scale, this is just to remind you. Now, you've drilled your osteotomy, next you have to place your implant. In order to insert the implant, you use this extender, and there's a 2.2 hex on here at the end, and this driver will work with all diameters of implants. I repeat this because it's most important that you understand that this burr will work not just with the small diameter implants, but with the larger diameter implants. Again, it keeps things very simple when it comes to placing the implant, and also later on when it comes to restoring the implant, you have to just remember that one burr. Also, when you're setting up, if you see an empty space, you realise immediately that there's an instrument missing. so that won't surprise you in the middle of surgery. It says hex tool. This is our hex tool. You can use it with your fingers, but you can also use it with our ratchet to insert the implant into the patient like so. So this is our ratchet. Now when you've placed your implant, the next thing you will need to do is place the cover screw. This is the protective screw that protects the hex during the healing phase, and this is the driver for the cover screw. Again, this driver also works later on to work the prosthetic screws as well. So we have one driver for the entire prosthetic range for all our screws. So the whole system only has 2 hex sizes. Again, very easy to remember, very easy for your staff to maintain. Now if we go to the next level below, in this level here we have things such as your implant driver, and this is used in conjunction with your implant hex tool, and this is used when you're placing implants in the maxilla. We don't tend to use the ratchet at all in the maxilla, or when you're doing other types of more complicated procedure. Again, when you come to place the cover screw on implants in the maxilla, you'll use the same driver. So that's our universal driver. It's universal because it works with both hexes. This is our universal hex tool because it works with the cover screw and all prosthetic components. Again, keeping everything to a minimum. Then we have our implant carrying tool, and this is actually used to grab and remove the implant from the packaging or help support abutments. It's also got a prosthetics use as well. We have bone manipulating instrumentation, which will be the subject of another completely separate video, and for the majority of you, you will not be using these to begin with. They're for more advanced procedures. And we have our implant explorer. So you can see that this represents the entire placement kit. We really have tried to minimize it for you to make it very easy for you to place implants and maintain stock and inventory later on.